You know, over the past year or so, we have met a lot of the great physicians, surgeons with Singing River Health System, the different areas that they cover. Well, what you may not know here is that Singing River Health System is home to the most advanced pulmonary services that you'll find between Mobile and New Orleans, and between the Gulf Coast and Jackson. So we wanted to talk to the pulmonary specialist here today. Dr. Babar, how are you?
I'm good.
It's nice to meet you, sir.
Good to see you, Jim.
Give us a little bit of background first about yourself, if you would.
Well, I'm from Pakistan originally, and I did my medical school there. Came to Tucson, Arizona in, 1992, and did my residency, my fellowship. I went back to the university I trained at and served as faculty out there for 3 years. And then I got invited back to the University of Arizona, and I worked there for a year. And then I came down here to the coast, and I've been here for 16 years.
Oh, wonderful. Well, we're glad to have you here. I'm just reading some of the wonderful things about Singing River Pulmonary Care. Has been awarded #1 in Mississippi for medical excellence and patient safety by CareChecks for the last 5 years.
Yeah.
I mean, that's great. And as I was, you and I were talking earlier before we started this program, is that I've learned so many wonderful things about Singing River Health System, and where they have been like #1 or first in so many different areas that it's wonderful. And the great thing about it, too, is all the physicians, like yourself and the surgeons, how you work together in your achievement. Talk about pulmonology. What is pulmonology?
So pulmonology is the science of lungs. But of course, the lungs are closely associated with the heart, so sometimes our fields overlap a little bit. And when we talk about the lungs, and most pulmonologists are also critical care doctors, so we also work in the ICU and run the ICU. When you're in the ICU, you're basically taking care of any critically ill patient, whether it's a surgical critical illness or it's a medical critical illness. And then some of us are also sleep board certified or sleep trained, and so then we also do sleep medicine. So pulmonologists can wear a lot of different hats, but the core thing is the lung disorders.
Well, who needs to see a pulmonologist? That has to do with the lungs so much. Who needs to see a pulmonologist? I think of somebody maybe that smokes a lot.
Yeah, so, smokers certainly, anybody who has any kind of breathing problem, getting short of breath with exertion or hearing whistling sounds from their breathing, or if they have a persistent cough. The other thing that we are now doing is screening for lung cancer. So whereas before we had no screening procedure for people who smoked, now once they hit 55 and if they've been a smoker for 20 years or more, doing an annual CT scan to look for early signs of cancer. It's like getting a mammogram, like women get a mammogram.
Yeah.
So those are the things we do that people should see us for.
How do they get referred here?
Most people can call our clinic and, they don't necessarily need a referral, but their primary care doctors can always refer to the Singing River Health Pulmonary Services.
What is, I'm going to mispronounce this, I know, interstitial, is that right? Interstitial lung disease, what is that?
So interstitial lung disease is a disease in which the tissue of the lung gets scarred. And so it's kind of different from the COPD and the asthma that most people hear about. And honestly, a lot of people get diagnosed with COPD or asthma, whereas in fact it's something like interstitial lung disease. You often can't pick up interstitial lung diseases unless you do a CT scan on people. And the thing about interstitial lung disease is there's one form, which is called IPF for short, or idiopathic pulmonary fibrosis, that tends to progress very rapidly. And we now have medications that treat this disease. So at our center, we have a multidisciplinary approach to it. We have outstanding thoracic surgeons who can go and get a biopsy on the lungs robotically. And I believe you're the only place on the coast that does this robotically. And
I've seen some of the robots, too. They're amazing.
It's just amazing what our surgeons can do. And then some people are either too sick to get the biopsy, or they don't want to go through a surgical biopsy, and that's when we can do other forms of testing. We can do genomic testing, or we can do something called cryobiopsy, and we're the first people on the coast to do either one. down here to make the diagnosis. So I think this is a place if somebody has that diagnosis to be seen.
What is genomic testing?
So basically what it is, normally the diagnosis is made on a biopsy by the pathologist looking under a microscope and seeing certain architectural changes in the lung. We don't always get that when we get small biopsies through a bronchoscope. And so the genomic testing is actually a way of checking for RNA signals in the biopsy where you don't actually have to see that architectural change, and you can make the diagnosis. So it's a completely different way of looking at it and making the diagnosis.
Okay. Then on the other one, what is cryobiopsy? I know cryo has to do with freezing.
Yeah.
So tell us about that.
So again, this is a biopsy that is performed bronchoscopically, which means we put a fiber optic camera into the lungs, and through that we put typically we will put a little jaw forceps, which means the forceps with a little pair of jaws, and they go and take bites out of the lung. Problem is with that we get small pieces, 1 to 2 millimeters in size, and our pathologists can often not make a diagnosis. With the cryobiopsy, what we do is we put a little probe which has a frozen end, and it goes and sticks to the surface of the lung, and when we pull it back, we get about a 5 millimeter to 6 millimeter piece, a much bigger piece to make the diagnosis. So it's just another way of doing the biopsy, but it gives us bigger pieces.
Talk about pulmonary hypertension, if you would, please.
Pulmonary hypertension is something that is, I really think that is a center that we have down here that
you're the only one on the coast that has it.
We are the only one on the coast that does it. And we've been doing it. We'll be celebrating our 10-year anniversary. We've been running this center for 10 years. Pulmonary hypertension is an extremely complicated disease of the lungs where the blood vessels of the lungs get narrowed, because of which the pressure on the right side of the heart increases. This needs specialized testing and then treatment. We have cardiologists who specialize in doing the catheterization that diagnoses the disease. And then we, as pulmonologists, have ways of treating it which include continuous infusions that can treat these people. And I believe we are the only people on the coast who offer that service.
And Mississippi is kind of high on that list of people that having to deal with hypertension problems.
Right. So that's systemic hypertension, but we have a very large population of pulmonary hypertension also. So
wow.
Yes, certainly.
That's awesome. Dr. Babar, it's been a pleasure.
Thank you.
I've enjoyed so much meeting all of the different doctors and physicians that they have here at Singing River Health System. I learn something every time and about the great advances that they are, and number one in so many different areas. If you're having some issues with your lungs, pulmonary issues, again, as Dr. Babar said, you don't need a referral, but make an appointment, numbers on your screen, and get checked out with Singing River Health System.